Upper limb, surface anatomy, axilla, and the breast, clavicle and scapula, palpable structures, coracoid process. The tip of the coracoid process is palpable immediately below the lateral third of the clavicle and deep to the medial margin of the deltoid muscle. To palpate the coracoid process, place your hand on the deltoid muscle and grab it with your thumb. Your thumb will now be in contact with the coracoid process. The acromion. The acromion is an anterolateral projection of the spine of the scapula. It arches over the glenohumeral joint and articulates with the clavicle at the acromioclavicular joint. Palpate the acromioclavicular joint by pressing medially above the acromion. Axilla. Contents and boundaries. The clavicle forms the anterior margin of the axillary inlet. The tip of the coracoid process forms the lateral limit of the axillary inlet. It is palpable immediately below the lateral third of the clavicle and deep to the medial margin of the deltoid muscle. Axillary walls. The anterior axillary skin fold that overlies the pectoralis major muscle forms the anterior axillary wall. The posterior axillary skin fold that overlies the teres major muscle laterally and latissimus dorsi muscle medially forms the posterior axillary wall. The long thoracic nerve of Bell and the lateral thoracic artery passes down the medial wall of the axilla in the mid-axillary line. The long thoracic nerve of Bell innervates the serratus anterior muscle. The thoracodorsal nerve passes down posterior to the mid-axillary line. The thoracodorsal nerve innervates the latissimus dorsi muscle. Damage to the long thoracic nerve of Bell must be avoided in axillary surgery, for example in breast cancer surgery. If this nerve is damaged, this would result in winging of the scapula. There will be impaired shoulder abduction and loss of function. The humerus forms the lateral axillary wall, and the dome of skin between the posterior and anterior axillary skin folds forms the floor of the axilla. Contents of the axilla. The axilla contains the axillary artery, the axillary vein, the divisions, cords, and branches of the brachial plexus. They travel lateral to the dome of skin that forms the floor. Palpate the neurovascular bundle by placing your hand into an armpit and pressing laterally against the humerus. The axilla also contains 5 groups of lymph nodes. The anterior or pectoral group drains the lymph from most of the breast. Lymph from the upper trunk and the axillary tail of the breast drains to the posterior or the subscapular group. The lateral group drains lymph from the ulnar side of the upper limb. The lymph from the anterior, the posterior, and the lateral group of nodes then drain into the central group. The apical group receives the lymph from the central lymph node and also the deltopectoral nodes, which drain lymph from the radial side of the upper limb alongside the cephalic vein. Deltopectoral groove. The deltopectoral groove lies between the deltoid muscle and the pectoralis major muscle. The cephalic vein is a superficial vein that arises from the lateral side of the upper limb. It penetrates the clavipectoral fascia in the deltopectoral groove to become deep before joining the axillary vein. The basilic vein is formed on the medial side of the upper limb and pierces the deep fascia as it approaches the axilla. It contributes to the formation of the axillary vein. The deep veins, or venae commitantes, receive connections from the superficial veins, and in the axillary region, they unite to form the axillary vein. The axillary vein then becomes the subclavian vein at the lateral border of the first rib, behind the middle third of the clavicle. The subclavian vein can be catheterized for central venous access just behind the middle of the clavicle. Aim the catheter downwards and medially as the subclavian vein is superficial here. The subclavian vein then joins the internal jugular vein to form the brachiocephalic vein behind the sternoclavicular joint. A catheter inserted between the two heads of the sternocleidomastoid muscle will enter the internal jugular vein and provide another route for central venous access. The breast. Although breasts vary in size, they are normally attached to the thoracic wall and lie vertically between the second and the sixth ribs, and horizontally between the lateral margin of the sternum and the mid-axillary line. It overlies the pectoralis major muscle. The nipple varies depending on the female breast size. The axillary tail of Spence extends superolaterally around the lower margin of the pectoralis major muscle and enters the axilla. The nipple in a male breast is usually in the fourth intercostal space,